Well, knee replacement surgery has become an increasingly common medical procedure for many people, but recipients often say they're unhappy with the results of their operation.
Now, new technology is allowing doctors to drastically improve the outcome of those knee surgeries. And here to explain how the technology could improve the fit of new knees on patients' body, Dr. Maria Palafox with the Previty Clinic. Doctor, good to have you in. Good morning.
Good morning.
I had knee surgery 2 years ago, but it wasn't a replacement surgery. It was just a quick fix type thing. But knee replacement surgery, once you get a little bit older, is becoming real common, isn't it?
Mm-hmm.
Yeah.
It's very, very common over the age of 65. The most common reason to need a knee replacement is pain due to arthritis, whatever kind, whether it's traumatic arthritis, like maybe you had a sports injury when you were younger, but most commonly osteoarthritis, just wear and tear.
Yeah, and that's the thing. You don't have to have a sports injury to probably need this procedure done.
Right.
Yeah.
Right.
Now, what are some of the problems we say a lot of people aren't happy with it? What do they complain about after these surgeries? That it just doesn't help the pain or it's not functional?
I think in the short term, right after surgery, probably the biggest thing is the rehab because it's very painful. I mean, it hurts to get through this. Once you get through that period, I had an uncle that had a knee replacement and he just had a heck of a time. But once the pain was gone, maybe 2 or 3 months later and he got through his rehab, he's very happy. But will he do the other knee? No, because it hurt. Yeah. So in the short term, probably the most common thing is postoperative pain and getting through rehab. And then over the long term, a lot of people still feel somewhat stiff. They don't feel like they have as much mobility as they want. And then unfortunately, some people continue to have some pain.
Yeah, and I think that's probably the most frustrating thing because, like you said, I mean, when they feel what happened on the one knee, and even once they get around to rehab, I mean, that pain is so bad that it discourages them from probably continuing on. Yeah.
So what are some of the different types then of knee surgeries?
Well, the knee surgery that I think you're describing was probably arthroscopic surgery.
Yeah, that's what I had.
So you go in with the scope and maybe you're cleaning up the meniscus or something like that. So there's not any hardware put in. And then the other one is a total knee replacement where they basically put in new parts, so to speak, that roll on each other like this.
Right.
And so what the new technology is doing is it's basically making this. You have to resurface the bone on either side and then put these new parts in. But on a small level, you can make minor adjustments based on this GPS system with the knee replacement technology to make it an even better fit so that when you're moving your knee, you don't have pain.
Yeah. I just wonder how natural it feels. I mean, have you heard anyone complain about it just doesn't feel right in there, or does it? Do they say it feels okay? It's just the pain that's the hardest thing.
I've had patients tell me that they feel like their knee is uneven, that it kind of leans more towards one side than the other. I've had some patients sort of mention that to me, and then other people it's too stiff. They can't bend their knee all the way, so they don't have as much mobility as they would like.
Yeah. Interesting.
All right, and some of this new mapping technology, I guess, is really making a difference for some of these patients.
They get a smoother connection, so to speak. The parts that are literally hammered into the bone sit better, and so overall you get a better fit. And they're having a lot better outcomes and a lot less pain with this technology.
I mean, this is something that we don't want to mess around with because even my minor knee surgery, I mean, when it's not right, it hurts. And so, you don't want to not have the correction done, but if it's something that's needed, you definitely want to look into it.
Right, because when you're not mobile, I mean, it really affects everything in your life. It's hard to drive even. I mean, we don't have a lot of cars that you put the clutch into anymore, but what if you did? Where you're driving standard, even that would be limited.
Yeah, sure.
Yeah, and so many people have to work like on their feet all day long and have to. So, I'm assuming that insurance then would cover this procedure.
That I do not know. I guess I assume it does. I have an interesting thing to tell you. Oh. Did you know that for every pound that you're overweight, you put an extra 3 pounds of pressure on your knee? Isn't that heartbreaking?
Yeah, that is heartbreaking.
That broke my heart because I think, well, that's going to be me someday.
Well, and that was part of my problem is I gained a lot of weight not being as mobile, not being able to work out as hard as I used to.
Because of your knee.
Because of my knee, and that affected everything. So I mean, it was good to finally get the procedure done. I tore my meniscus like 13 years ago, and I waited 12 years to have it fixed. So it was a long time. But anyway, glad I had it done. It turned out for the better. So good information.
Thanks
Appreciate
so much
all
for
that.
coming on this morning.
Thank you.
Let's get a check of this morning's forecast now with meteorologist Jeff.